So in each hall, we have a total of 4 operatories, which gives us a total of 12 operatories. So we have 12 rooms to treat patients in, plus an additional 3. Okay, this is our sterilization area. What we do here is once we're done with the patient, we bring the dirty instruments over. Everything is completely scrubbed clean in an ultrasonic machine, then dried up, rebagged, sterilized, basically baked so they get so hot that everything is cooked off. And then they're replaced in the room so that they can be reused on patients. So this is what we take intraoral radiographs with. This is placed up against the patient's face. We put some instruments in the patient's mouth with a sensor, and then that sensor, this is placed up against the sensor, and a picture is taken. Immediately after the picture is taken, it shows up on the screen. I mean, it's that quick.
I noticed that you have a lot of kid-friendly type of things, so you make them feel comfortable, I guess, right?
Yes, definitely. We offer a variety of services. We see children from age 6 months into adulthood. We have general dentists, several hygienists who treat all the patients that come into the dental clinic. We like to start at an early age because that way we can catch the parents of the little ones, the 6 months of age, and so that way as soon as the teeth erupt and are in the mouth, we can teach them how to start taking care of them and try to prevent oral disease or decay. We see a variety of things from those kids who have no cavities at all, and then those who come in with teeth that unfortunately need to be extracted due to dental decay. The goal is to start them off early so that they can get into a habit of keeping good oral hygiene habits early in life and then continue it throughout life and keep their teeth for life. That's the goal. Children ages from 3 years and up, the most common is decay and gingivitis. Periodontitis is when the disease attacks the bone and ligaments that hold our teeth in place. And that's usually older. It could happen in adolescence and then older. Dental decay can eventually lead to really severe and serious infections of the oral cavity. And what we're trying to prevent is people having this so that they can stay healthy and happy. When you don't have dental, or when you have dental pain, it's a distraction, especially for children that are in school. They can't concentrate, they can't focus, they've got this pain, they're swollen. So it's a big impact when they keep a healthy mouth.
If you have a mouth that's has a lot of these diseases or situations, that can lead to diabetes, that can lead to so many other cases, right? It can be infections in other part of the body. It's lead to so many things, right?
It's definitely linked. It's been linked to elevated blood sugar. It's been linked to elevated blood pressure. So it's all one, it's different. Our bodies are made of different systems, but our oral cavity is definitely connected to one of those major systems, the digestive system.
This community is really fortunate to have Gateway and to have all the services that they provide, including in the dental area. Is that correct?
Yes, most definitely. We have a state-of-the-art facility here with 15 dental operatories available to treat patients. So we are definitely an asset to the population here. We have a collaboration with the University of Texas Health Science Center in San Antonio. We have students, all year students, so in other words, their first through fourth years, they rotate through here and they are taught by our dental director, Dr. Claudia Cavazos, and other general dentists on how to treat patients and what to do clinically. And it's definitely a great collaboration with them. So as I mentioned earlier, we have collaboration with the UT Health Science Center in San Antonio. We don't only have students that come down, rotate down, we also have 2 specialties. We have periodontists that rotate down and we have prosthodontists. So those are 2 specialties of practice. They treat those with periodontal disease. Watch it behind you. They treat those with periodontal disease or gum disease, severe gum disease, and then they also replace missing teeth on people who are missing teeth.
Okay.
And this is what they do. So they make dentures and things of that nature. This is a dental laboratory. What we do in here is that once a person needs to have teeth replaced, what we do is we make an impression of their mouth, and then we pour up that impression, and then this is what the result is. And so once the impression is poured up, then they fabricate, such as this one, they fabricate the missing teeth here, and this is where everything is fabricated. So they take down they fix the stone and make the mouth just the way it would be, kind of recreate the mouth per se, with impressions.
So you're not just, it's just not the regular dental stuff. You have specialty areas that
Right.
come here to the clinic to help with those special cases. Is that
That's
correct?
correct. That's correct. Yes.
Okay, so-
So these are dentures. This is a full denture. That's a full upper denture. That's a full lower denture. This would be considered a partial denture because it doesn't replace all teeth. It replaces just some teeth. This is a crown. This here is a crown.
I see. Yeah.
See, it just replaces the part of the tooth that may be decayed, completely decayed. So we have a total of 7 general dentists and 3 hygienists and plenty of support staff for all those. So, each dentist has 2 assistants, and then we have extra assistants to handle other things such as x-rays and putting things into the chart, vitals, as we talked about earlier, taking the blood pressure, the medical history, and things of that nature. So yes, it's a very busy clinic. We see a lot of patients, but we have the staff to be able to support that patient flow. The majority of our population are those who don't really have any money. The majority of our population here in Laredo is below the poverty line. And so we treat, the majority of those people come to us for help, and so we're here for them. And the majority of them are so thankful that we're here for them.